So hello everyone, this is Dr. Singaram, Pediatrics faculty. So today we have with us Dr. Soumyadeep Sarkar, who has secured the prestigious rank 2 in AML, AML rank 2 in this recently conducted INA SS 2024 exam. So first of all, congratulations doctor, and um, for getting a very good rank in this recent INACT exam.
Thank you, sir.
Okay,
It's my
right. So
pleasure to give the tip. Yes.
thank you. Thanks a lot, Dr. Right. So I'll give an introduction to Dr. Soumyadeep Sarkar. He did his undergraduation from Sakudatta Medical College in Kolkata and secured a prestigious rank in his postgraduate exams as well. And he got into MD Pediatrics in IPGMR, Kolkata. Now, in this INACT SS, he has secured yet another amazing rank of AML 2 in this exam, and he's planning to take up in the specialty of clinical immunology and rheumatology. So that was about his introduction. So we will get started with the interview, doctor. Um, so, so can you tell us briefly about your journey of preparing for this INACT exams or super specialty exams? Did it start during your residency itself or after completing your residency? Can you tell us a little bit about it?
Sir, actually, one thing I was clear in my mind that I want to do a further course, higher degree after
Okay,
passing MD Pediatrics.
very good.
So in my college, I had a specialized rheumatology lab and multiple patients of pediatric rheumatology we dealt in the MD Pediatrics days. The
Okay,
part that in case of pediatric rheumatology, the part that fascinated me the most was the part of primary immunodeficiencies, multiple cases we dealt, and other cases such as the vasculitis and other nephropathies that related to vasculitis were also dealt in the MD Pediatrics course. So I grew a fond and interest in the branch of rheumatology.
okay.
But
Very
a
nice to hear.
particular, yes, sir.
Yeah, please continue. Please tell me.
Okay, sir. But in this 3 years tenure, I didn't prepare particularly for this course.
Okay,
I saw the patients. I read the textbook,
okay,
Nielsen textbook of pediatrics, and went to see the patient again. The anything that caught the attention of my boss or me, I would
yeah,
read the review articles or other papers, and this is how I grew interest and a few expertise in this branch.
okay. So your interest happened as your MD pediatrics was going
Yes,
on, and you
yes.
eventually were more inclined to rheumatology, right? Okay, right. So basically, your preparation as such for the exams, did it start after completing your MD pediatrics?
I- uh, Actually, the preparation, the focus preparation for rheumatology only lasted about a
Correct.
period of 30 days when they
Okay.
gave the seats for pediatric rheumatology. Because
Okay.
after passing MD pediatrics, this is the first time they have given some general seats, open
Okay.
seats for
Okay.
pediatric rheumatology. So
Okay.
it took me 30 days to read, but I had previously read the subject well.
Okay.
And I have gone through Nielsen couple of times in my MD pediatrics days. Fortunately,
Okay.
all the the major chunk of the question were from the Nielsen only.
Okay.
So it helped me a bit during the exam.
So reading Nelson during your MD days gave you a solid base to prepare upon further in the rheumatology part, right? That is what
Yes,
you
sir.
wanted to
Yes,
say.
yes,
Okay,
yes,
right. So that is always the usual rule we say, like whatever specialty you take, you have to be a master in that. So building on that, you have further improvised and have secured this rank in clinical rheumatology. Okay, very nice. So during your preparation time, so can you tell us the role of Marrow videos test? How did it help in your course of preparations? Can you tell us about it?
sir. If I want to tell about Marrow, like hundreds of children, I must first tell that Marrow was an integral part of my preparation during my NEET PG days. So when
Wonderful.
I found that Marrow is launching SS
Yeah.
course, I had to subscribe for Marrow.
Okay.
So, but
Okay.
unfortunately, the after I passed MD Pediatrics, I
Okay.
the launch of Marrow happened.
Okay.
After that, I subscribed to Marrow. I
Okay.
have went through multiple subsections of the subspecialties that are taught. I
Yeah.
have went through the hemato-oncology part, the pediatric hemato-oncology part, the pediatric neonatology part, and
Okay.
in the general pediatrics, the updates that you have taught,
Yeah.
the approach to reactive arthritis, the SLE perspectives, the
Yeah.
connective tissue diseases, hereditary connective tissue diseases,
Yeah.
I have wrote this part.
Okay.
So those helped me to make my notes and get a base and just revise Nelson very quickly.
Okay.
That had helped a bit. Yes.
Okay. Right. Okay. So it's more of a addition to your existing knowledge. Right. Okay. So while you were studying or preparing from videos, what was your approach to the notes part? Did you separately make it, or you already had that notes which was already available in app and try to build upon it? Can you tell us
No, sir.
about
I
it?
used to write. I used to write
You used to write
after.
separately.
Yes, sir. Yes, sir. After
Okay.
watching your videos, I used to write and then again go through Nielsen and whatever part was missing, I used to incorporate in my notes. In which
Okay.
cases the videos were available. Otherwise, I used to read Nielsen only.
Okay, okay, wonderful. Okay, right. So, while you started your focused preparation for this super specialty exams, can you tell us in a day roughly how much of a time would you devote for reading stuff related to the exam, particularly in addition to your routine work?
Sir, I'm currently pursuing as a senior resident in
Okay,
Calcutta National Medical College. So I
okay,
already have to do a work of 70 hours a week.
yeah,
So keeping that aside, I used that days I got off from my work. I would devote about an hour each day. No,
okay,
not during this period, but after I passed my MD, I would study 1 hour. I would try to study 1 hour at least a day. But in
okay,
this period, I would take a gap from my work for at least a period of 2 weeks and would study at least 8 to 10 hours a day. I tried to
okay.
study 8 to 10 hours a day.
Okay, so that was near to the time of approaching the
Exam.
exams.
Yes,
Yeah.
yes, sir.
Okay, okay. See, I think this is what is applicable to majority of the pediatricians who have completed the MD also, right? So they will be in some sort of a clinic setup or in a residency setup. So I think this is what is practically possible. Just to be consistent, whatever be the time you devote, and before the exams, you need to devote more time. That is what you are saying, right? Okay, right, very good. So just one more thing I wanted to ask is, of course, studying is one part and giving exams is the next part. So while giving exams, whether it's a mock exam, GTs, or focused exam like the subject-wise or the specialty-wise exams, what was your strategy towards that? After reading, giving the test, can you please tell us about it?
Sir, approaching the GT and analyzing a GT, I would again like to thank Marrow since my NEET PG days.
Okay,
Marrow inculcated a habit in most of the students nowadays to give GT, read and again give GT to see
okay,
whether the score is improving or not.
okay,
Again read and again. So in this time, in the NEET SS preparation or INI SS preparation, it is not so much possible to give regular GTs. But I
okay,
started giving GTs from the month of March, and
okay,
whatever may be the subject the GT was. Suppose I was preparing for pediatric rheumatology, but if even if the GT was for hemato-oncology or critical care, I would give it because the general pediatrics part would help. So I
okay.
started giving this part also.
Okay. So it is not just focused GT for a specialty, but every other stream also needs to be included because anyway, one part of the questioning is related to the other aspects of pediatrics. So
Yes,
you want to say that every aspect of pediatrics, not just particular to the specialty, needs to be focused on, right?
yes, sir. I
Yeah,
feel that the 25, they will give a majority of the question from the part that we are
yeah,
applying for. That's agreed. But
yeah,
those 25 questions that
yeah,
they ask from the general pediatrics
yeah,
is also a very important game changer in exam because
definitely. Yes, yes, yes. So when you used to prepare, uh, did you use any other resources for your concerned specialty, or Nelson was the only one which you used for the enterohematology part? Can you tell us about it?
is the updates, multiple updates had come on in the recent years. For example, the macrophage activation syndrome new drugs had come on. Lupus
Okay.
vasculitis, random major change have been given.
Okay.
In Kawasaki disease, the approach has changed.
Yes.
I would search for the latest article of the recommended guideline. For rheumatology, it is Euler
Euler
guidelines,
guideline.
ECR guidelines. These
Okay.
I would search any update has come or not, and I
Okay.
would used to read those. Otherwise,
Okay.
some IAP based guidelines, for example, a vaccination guideline has come on for the rheumatological diseases by IAP.
Okay.
I had read those. So a particular guideline update from a particular authorized source I would read
Yeah.
in the field that I would feel that I require to know more.
Okay.
Uh,
So it was not
I,
anything like a particular textbook like that. It was more of guidelines and updates from the reliable sources, right? Concerned
yes,
to
sir,
your
I would
specialty.
focus mainly on the Nielsen and
Yes.
other. I would read the multiple materials and the updates from the authorized source.
Okay, I get it, right. So Nelson as the main or the base
Yes.
and add upon this all the other updates from multiple sources, right? Okay. Right. So so just for the future aspirants, I wanted to ask this. Suppose somebody wants to start the preparation for the upcoming sessions. Uh, what would be your advice when they start beginning the preparation, right? Some from where they could start, like a starting point and to build upon it. So your insights on this will definitely help our future aspirants.
Sir, I would, as Marrow has brought the subspecialty courses which was not present during my PG days, I
Okay.
would suggest them to see the patients. The head is the first and foremost. You have to see the patient and
Obviously.
learn.
Yeah.
Next, you read the books and supplement with the Marrow videos, because what have
Yeah.
happened after the Marrow videos is that you don't have to read Hansowski for pediatric hematology. You don't
Okay.
have to read Cassidy for pediatric hematology or other such as. So you
Okay.
can read Nelson, you can get the update and incorporate that into your Nelson or the notes you are preparing and
Okay.
read it and see the patients again. It will create a strong base, and I guess it will not be so tough in the
Yeah.
further exams.
So you wanted to say that those who are prospectively appearing for the future exams, they don't need to especially focus during their residency phase. They just have to do it along with their usual course. And once
Yes,
the
sir.
exam approaches, then they can focus more on that, right?
Yes,
That
sir.
is
Yes,
what you
yes,
wanted to say, right?
yes, sir.
Absolutely. I agree with that 100% because that is what is our, I mean, like usual advice to all the postgraduates also to focus on the pediatrics as a whole. And as you approach towards the exam, you just increase your knowledge about the concerned specialty. Okay, very nice. Right. So I know that you have already opted for clinical immunology and rheumatology. So just tell us in which institute are you planning to join for your DM courses?
Sir, they have given 4 seats in PGI Chandigarh, so I will take PGI Chandigarh only.
Wonderful and best wishes for your super
Thank you.
specialty course. And just a general question I wanted to ask is, how should a postgraduate in pediatrics decide upon what type of super specialization they wanted to do after completing MD pediatrics? So, so anything which you wanted to say for them who are in a dilemma to choose their specialty, like
Sir,
what would
I
they?
had this dilemma for a period of 7 to 8 months. I couldn't
Okay,
decide which brand to choose, because the
okay,
problem is that many of the pediatric, after passing MD pediatrics, many of the doctors choose to do adult subspecialties,
okay,
and some and majority of the seats that is given to the subspecialties in pediatrics is
adult,
allotted to neonatology. But the
okay,
problem that I felt with neonatology was that the major essence of pediatrics, that was um, the approach to a patient, the
yeah,
examination part, these are not dealt in neonatology so much.
okay,
So I didn't find man, man, how, he didn't find so much interest in
okay,
doing a course in hematology. So I
excellent,
wanted to do either paid rheumatology or paid endo or paid hematoncos, like that, which deals with
okay,
multiple systems, had a good
okay,
outcome also. They had an
okay.
outcome based approach. So I would like to suggest all those who are finding it dubious to take a call what they want. If they want to deal with multi-system disease, then they can choose the branch they want to pursue. If they want to be safe, they can choose neurology because the multiple seats are there.
Yes, yes, yes.
Likewise they can do.
That is true. That is true. Because I think to begin with, when the super specialization started, it started with the intensive care in pediatrics and neonatology. So obviously the number of seats would be more, but still it is an ever expanding subject. So I
Yes,
think as a pediatrician, we develop some interest as we keep learning. So I think that should be the factor which should help you to choose course,
yes,
right?
sir.
Yeah,
Yes,
it
sir.
is individualized, but
The
yeah,
branch
thanks.
that one enjoy is he should choose that only.
Yes,
That I
yes,
can suggest.
yeah. You're going to stick with it for a lifetime. So why not
Yes,
a
yes,
branch
sir.
of your choice, right? So that is
Yes,
very correct, right? That is very correct. And I think that that choosing a branch will eventually happen as the MD pediatrics course is happening, right?
yes,
That is true.
yes,
Okay,
yes,
right.
yes.
Fine, fine. Yeah. Now, just one more aspect I wanted to discuss with you is about this INACT SS exam. I just wanted to ask about the pattern of question which was asked in this INACT. Was it like the usual trend, or did you find anything different or away from the usual pattern? Can you
Sir,
share your thought?
I appeared for INI SS in December 2023, which was my first attempt. I didn't
Yes.
appear for the April session. I
Okay.
again appeared in this session.
Okay.
So from that session, what I could figure out was that the general pediatrics part was asked in more details
Okay.
in this session because and they asked multiple questions from IMS, NICU, and PICU protocol. They
Okay.
asked multiple questions on oncology part.
Okay.
That was a part. Regarding pediatric rheumatology, everything was from Nelson, but the atypical topics such as interferonopathies, autoinflammatory syndromes,
Okay.
these
The recent
things were
updates in
dealt.
it. Right.
Yes, sir. These things were dealt in very details in the exam, and they asked about some questions of juvenile scleroderma. They asked about the lupus updates, and
Okay.
if pediatric rheumatology, majority of the questions were not from rheumatology but from immunology. The immunology
Immunology.
part has to be very strong to appear in this
Okay.
section.
Okay. So there is definitely some change in the pattern as far as the
So the
specialty
general
was concerned.
pediatrics questions are getting tougher. The general
Tougher.
pediatrics questions are getting tougher.
But still, the base was from Nelson,
And Nelson,
general
yes, sir.
pediatrics also.
Everything of the 80 questions,
Hmm.
the 70 questions were are lines of Nelson.
Nelson.
That
Okay.
the rest
So
10
Nelson is
was
like the
five.
Bible. There is no
Yes,
undisputed
sir. Yes, sir.
question.
No dispute. No disputes.
Okay, right. Okay, okay. I understood. Understood. Okay, yeah, yeah. Now, okay. So that was about the pattern you were saying. Like, suppose as you were approaching the exams, did you adopt any strategy or something like a last revision strategy like that, which you want to share with us so that it can be helpful for the prospective aspirants also?
So what I used to do was read one topic a day. I I mean that I used to read. Suppose I read SLE today.
Yeah.
I would start to tomorrow's morning by revising SLE in about a period of 45 minutes. Then I will study another new topic. That's how I used to do. So that I can retain more each
Okay.
day.
So it's
That's how
more
I
of
used to prepare.
a revision based
Yes, sir.
learning.
Yes, sir.
That's all. Okay,
Yes, sir.
right.
That's what
That
I
is
used to do.
okay. Now, as you approach towards the exam, any particular strategy or any new things you wanted to follow, or just the revision of the notes multiple times?
Only the revision only. I didn't read anything new because he didn't have much time also.
Okay,
To be
okay,
honest,
yeah,
I started 30 days before. So I had to cover Nelson. The new edition had come up and with the multiple updates. So
yeah.
I had to revise these things multiple times.
Okay,
So I didn't
okay.
have the time to go for new things.
Okay. So yeah, I think that is the situation for most of the pediatric residents also. So within the time, whatever you prepare, you revise it multiple times, not to read anything new towards the last, I mean, few days before the exams, right? It is multiple revision with the updates if at all you need to add on, right? Okay,
Yes.
right. So that is what I wanted to say. Right. Okay. Okay, doctor. Just one final thing is like you're saying that you were giving grant test as you were approaching the exam, and did the grant test help in your final exam, like did it help with your the timeline as well as your scores, were it correlating with the actual exam, or you want to share any insights about
But
that?
actually, I didn't give any grand test for pediatric rheumatology, so the
Rheumatology.
scores didn't correlate. Because the pediatric rheumatology grand test was not present at that time.
Okay.
Number one,
Okay.
and secondly, but the grand test must be given irrespective of the branches prerequisite or not, because the mistakes that I do, the things that the more mistakes that I make, the things that I remember more. Suppose I still remember there was a question of Hasselman disease
Okay.
in some of the GTs. So the
Okay.
CD marker of I used to do wrong.
Okay.
After I did it wrong in the GT, then I remember it for long. So
Okay. So definitely
giving GT
giving
is
GTs
important.
is must. There's no
Giving
compromise
GT
on
is
that.
must.
Okay. So did you? I mean, like you're not. You said that you didn't give many GTs, but like you can just share with us what should be ideal from your side to be done for giving the number of GTs as the exams approach. Any particular number you have in mind, or it's just along with the preparations you wanted to do
Sir, I would suggest that GT per month would be enough
per
in
month?
this stage. In this stage per month, one GT per month
Yeah.
would be enough, and two GTs before giving exam in the preceding month would be good.
Okay.
That I
So
would suggest.
whatever mistakes you learn from the GT, that is something which you need to work on. Okay.
Yes, sir.
Yeah.
Yes.
Always. So I think it was wonderful spending time with you and getting your part of this INA SS exam, and also your advice to the future aspirants would definitely help them in securing their seat also. And I wish you all the best for your upcoming endeavors and in your upcoming uh, career in clinical immunology and rheumatology. So thanks a lot for your time, and best wishes for your future endeavors.
Thank you, sir.
Thanks a lot, Doctor.